In today's video, we will be talking about varicocele. What is varicocele? What are its symptoms? How is it diagnosed and treated? You will find the answers to these questions in this video. At the end of the video, I will answer all the questions you may have about varicocele. A varicocele is an abnormal enlargement and swelling of the veins in the scrotum, the loose sac of skin that surrounds the testicles. It causes swelling and pain in the scrotum, similar to varicose veins in the legs. It usually occurs during puberty and can progress over time. Pain can range from mild discomfort to sharp pain. Pain may increase with prolonged standing, exercise, or hot weather. Scrotal swelling is the most obvious symptom of varicocele. The swelling is caused by the enlargement of the veins in the scrotum. Unlike pain, discomfort is a milder and more constant feeling. Varicocele is one of the most common causes of male infertility. Varicocele can lead to increased testicular temperature and blood stasis, which negatively affects sperm production and function. Swelling and vascularization may be seen on the testicular skin. Varicocele is usually diagnosed with a physical exam. The doctor can feel the enlarged veins in the scrotum by examining and palpating the scrotum. In some cases, your doctor may order ultrasound and Doppler ultrasound to confirm the diagnosis. Ultrasound used to obtain an image of the veins in the scrotum. Doppler ultrasound used to assess blood flow in the veins. Semen analysis may also be requested by your doctor. Here, sperm quality is wanted to be checked. Mild cases may not require treatment. In cases that cause pain or infertility, surgery may be recommended. In surgery, the enlarged veins are tied off or cut. Different surgical methods can be used, such as open surgery, microsurgery, or laparoscope surgery. Nowadays, minimally invasive methods such as percutaneous embolization are also used in the treatment of varicocele. The exact cause of varicocele is still unknown. Therefore, if you are experiencing such pain, you should definitely get checked by a doctor. Varicocele consists of 3 stages. It is classified as Grade 1, Grade 2, Grade 3. Grade 1 may not cause any pain in the first stage. However, a person can learn under the supervision of a doctor. At this stage of Grade 2, the enlarged veins may be slightly visible from the outside, and the patient may experience frequent pain. In the Grade 3 stage, the veins are now visible from the outside. The patient frequently experiences testicular pain. Varicocele disease does not heal on its own. If it is in the early stages, it should be followed up with a doctor's supervision. If the patient has reached the Grade 3 stage and is experiencing unbearable pain and has low sperm test values, surgical intervention must be performed. It is thought that varicocele disease also has negative effects on sexual health. These are erectile dysfunction and sexual reluctance. You can support me by subscribing to my channel and turn on the notification bell to be informed about my new content. I wish you healthy days.